Hello and welcome to the NewsX Sunday Guardian Roundtable. Well, we're here discussing taking another look at the COVID situation as it stands today. We've been told that a third wave is around the corner. We've just, in fact, just got out of the second wave and there is already the fear of a third wave. And actually, one won't be surprised seeing the amount of people who are walking post lockdown without masks. It really appears as if nobody has really learned the lessons of the second wave. So, to discuss what is in store for us, when will the third wave come, what is the signs and symptoms that one should look for, will it be more lethal? We're already hearing about the Delta Plus variant. Are our old vaccines ready to tackle this new variant? And of course, the black fungus. What are the lessons that one has learned from the second wave? Joining me on the roundtable today is Dr. Romel Tikku. He is the Director Internal Medicine at Max. We have Dr. Bernali Datta. She is Director for Respiratory Medicine at Vedanta. And Dr. Harsh Mahajan, he's the founder of Mahajan Imaging. Dr. Tikku, how scared should one be for about the third wave? What are you hearing? When do we expect it? And what are the signs and symptoms that one should look out for?
Well, we have to be scared and we have to be worried because we've seen what this virus can do, especially the mutant strains. We've had a devastating second wave. And now with the threat of this Delta Plus variant looming large and with the economy opened up and restrictions have been eased out, decline in the number of cases in the last few days now, there's a tendency for people to get complacent. And that's what we should be looking at. And we should not let our guard down at all. We have to be extremely vigilant and we have to follow COVID appropriate behavior. We have to wear a mask. We have to maintain distance. We have to work from home. This has to become a way of life. Otherwise, we're looking at a potential third wave. See, as far as this...
my first interview with you was when? I think in September last year, October last year. And we've been talking, so 1 year and you've been repeating this over and over again. People have not yet got the message, isn't it? That's the scary part. Every time we speak, you give the same warnings out.
Yeah, the attitude hasn't changed at all and it doesn't really help. So what do? I think vaccination is the key then. Because if people are not going to wear a mask, they're not going to follow the safety protocols, then we're in for trouble. Almost all the families have lost a dear one. So we have gone through such tough times. We have to understand what this virus can do. And with this new variant coming up, though we hardly have 48 odd cases in India, but it has a potential to create trouble because it's similar to the Delta variant. Plus it has another mutation and it has increased transmissibility and a stronger affinity for the lung receptors, and it can create havoc. So it's being studied. We don't know much about it. There are hardly 48 odd cases, but it's spreading. It's in almost 11 states in India, and even outside of India, 11 countries. So one has to be extremely careful with this. And those areas where it's being found, we have to be very, very aggressive. There has to be increased surveillance, and there should be no gatherings, no crowds. And immediate containment measures have to be there in place, and also widespread testing. I think that's very, very important, apart from contact tracing. And I really feel that aggressive vaccination on a priority basis, at least in those areas, should be done. We also have to look at their symptoms, signs, these people who had it. What was their travel history? Were they vaccinated, not vaccinated? Because the ones who had it in Madhya Pradesh, I think 4 of them were vaccinated, they recovered well. 2 of them were not, so 1 of them has died. So there is some anecdotal evidence that the vaccines do work. And if we talk about the Delta variant, so these 2 vaccines which we have, Covaxin, Covishield, they do protect us from the Delta variant. There is data regarding that, a lot of data. So I'm pretty hopeful that this the vaccines that we have will work against it. But to what extent, we don't know. See, the concern is that this also has a mutation, K417N, which was seen in the Beta variant, the South African variant. And AstraZeneca vaccines probably do not work against that variant. So that's why there is a little bit of issue here with the vaccine and the effectiveness of the vaccine and this particular variant. But it's being studied. ICMR is doing a study on it. And what we really need to do is to do genomic sequencing, which we're now doing in a big way, so that we follow the characteristics of these variants, and accordingly we can later on tweak the vaccines and make them more effective against it. And to prevent the third wave from coming, I seriously feel that we have to enforce safety protocols, do genomic sequencing, and vaccination is the key. And I think we're doing pretty well. We started with a bang, 88 lakh people were vaccinated on day one, and then it was 52, then 64, 60. So consistently, we're doing more than 50 lakhs, which is good, but we can better it. So if we do 80 lakhs a day, then by December, majority of the population will be vaccinated. If we do 50, then by March. And if we do 1 crore a day, then we do it by October, we'll be through. So, but if we do at least 50 every day, then by March, 70% of the population would have had one dose. So I still feel that vaccination is going to take us through, and we have to be aggressive about it. And we do talk about the shortage of vaccine, the pricing, the production barriers. But one thing we ignore is vaccine hesitancy. I think that's going to be the biggest challenge against this vaccination drive. There are a lot of people, the vaccination hesitancy rate in India is 30%. A lot of people who don't want to take the vaccines. I'm sure vaccines do go waste also every day because of that. So one has to really handle that. And the reason for that is misinformation, fake news everywhere, and people go by that. They don't listen to the experts. And fake news, misinformation about safety, efficacy has a potential to derail this ambitious vaccination drive. So effective communication with people, awareness campaigns, rope in celebrities, cricketers, film stars. I mean, we all have to do it. Doctors have a big role to play because society at large does have trust in us. They believe in us.
Interviews like this. I'll get Dr. Datta, and also, what have you, first of all, is the situation better right now? And what are we expecting from the third wave?
Yeah, no, definitely. I mean, the situation is much better vis-a-vis the acute COVID cases. We can see that, the acute cases, new cases are virtually none in the hospital at the moment. So we came from a peak of around 500 patients at one time when we were at the peak to something like, 4 or 5 who are just sort of lingering, and they will. But I have to say the burden of post-COVID is still large on us. And, right from black fungus to really bad fibrosed lungs to people suffering with, infection, septicemia. So our wards are still clogged with all of that. I mean, of course, non-COVID has also come back. The cardiac patients, the oncology patients. So our hospital's full again with all of these, and so it's a place where we are in this rift between the second wave and the anticipation of the third wave, which will inevitably come. I think we know that now that, waves, you can't prevent the waves. They will come because that is the inherent nature of the virus, that it keeps mutating. And then there will be some, mutations which will be irrelevant, but then there'll be some which confers these properties of increased transmissibility and virulence, and then they tend to dominate. So without a doubt, a wave will be there. If, as Dr. Tiku pointed out, all the various perspectives of it, if we are able to do surveillance, do COVID appropriate behavior, vaccinate aggressively, yes, we may blunt that wave, and that wave may not come with the kind of ferocity that the second wave came. So we are in that space where, but I think we are definitely, although seeing the population at large, we can see that there have been possibly not many lessons learned. But scientifically and from the government perspective, I think the surveillance is definitely much better now with genome sequencing and our overall sort of knowledge of the way the virus behaves, and hopefully we will be therefore able to kind of counter or deal with the third wave more effectively than we did the second wave, where we had completely become far too complacent. We dropped our guard, and it was almost like we'd won the battle, whereas that was never going to be the case.
To share her optimism, Dr. Mahajan, in terms of, are we more prepared to handle the third wave, or are you pretty disappointed at what you've seen so far?
I think if you talk about medical infrastructure and preparedness, I think we faced the second wave and places got overwhelmed. Even in Delhi, we were overwhelmed, and we had deaths of people in the parking lots, in their ambulances, for want of oxygen or want of proper treatment, respiratory support. But because of that, and because of the prodding that happened, both from society at large, the courts, the government itself, I think we would be better prepared for the third wave as and when it comes. because we faced a massive second wave. I mean, 400,000 new patients in one day is a world record by a long way. And so we've seen it, we've faced it. Of course, as doctors, we hope that we never have to see it again. But definitely we are better prepared. Oxygen preparedness is much better. We have oxygen generators, which have been set up in many hospitals, especially in areas, geographical areas of the country like Delhi, Mumbai, which are far from where the oxygen production actually happens. Hopefully, in the months to come, we will also have more of the oxygen, liquid oxygen tankers, which India, I think, was about 1,000 tankers short. And also, I think we've learned how to better utilize the oxygen capacities that we have. And the new committee that was set up by the Supreme Court, it is, I think, today or yesterday given its recommendations, and probably we would be able to distribute the existing oxygen within the country much better, apart from the fact that we've been able to ramp up production. Also, I think we realized what medications are necessary, are useful, which ones work, and some of them have been taken out of the equation by the ICMR and the government recommendations, like remdesivir. Now they say, is not really necessary. Same with some of the other cheaper medications. But still, I would say the onus is on us as citizens of this country to, as has been said by Rommel and Bernali, that we have to blunt the third wave. It is inevitable. It will come. We've already started seeing the beginnings of it in Maharashtra, and there the government is quite cognizant of it and trying to contain it. We've seen that it started in the UK. There's always been about a 2-month lead that some of the Western countries have had on India as far as the beginning of the next wave is concerned, and the UK is really concerned. The one area where things are improving, but I think they need to be improved much, much more, is in genomic sequencing. In this country, till February of this year, we had only sampled about 6,000 samples. And both the WHO and the Indian government is duty bound or have agreed internally to do 5% of all positive samples. And that, if we look at 2.8 crores or more of infections we've had in this country, it runs into lakhs. And even today, even though in the last month or so, things have been ramped up from just 10 centers which were permitted to do, genomic sequencing, it's now been up to 28, 18 more have been added. Also, there is increasing thought that private sector centers, and ours is one such center, which is capable of doing genomic sequencing, that they should also be brought into the fold. I hope that from now onwards, at least we'll follow that 5% maximum, because the numbers are small. So 5% of, say, 30,000 or 40,000 is not as much as 5% of, say, 4 lakhs a day. So from now onwards, because it's very, very important to be able to pick up the mutations as early as possible, and some of them will be variants which will be of concern. Some will become variants of interest, and then we follow them up. Unless we follow them up, unless we pick them early, there's going to be hell to pay. Remember that it was in Maharashtra in the early days of October that we picked up the Delta variant. And had we actually gone to town with genomic sequencing, probably it wouldn't have been as late as March or April that we would have realized this is spreading across the country. And maybe it wouldn't have gone to other parts of the world as well, if actually it has gone from here and mutations have de novo not developed in the other parts as well. So that is a lesson learned, and that is something now at least we need to do, and do it very diligently. Maharashtra, for example, has now said that 100 samples from every district will be sent for genomic sequencing. I think we need to do even more. And as Rommel has said, in the areas where we find these, new variants coming, whether it's Delta plus or a Delta minus or a Delta plus plus, God only knows where we will go. We need to do genomic surveillance, not just by antibody testing, but by genomics. And then we need to create containment zones very quickly so that it doesn't spread out from that area.
Dr. Tikku, lessons from the second wave, how that will help us in countering the third wave. Dr. Mahajan talked about the medicines, certain medicines have been taken off the list, but what else? How do we prevent black fungus happening?
See, apart from that, we also have to understand the loopholes of our healthcare system have been exposed by the second wave. So much before the second wave hit us, it had affected the other countries of the world. And we could have learned from their experience. We could have ramped up our healthcare infrastructure, but we didn't do that. What we have to understand is that we have to prioritize our healthcare system and strengthen it on a long-term basis, not only during the pandemic. And for that, India's healthcare system, I think, needs a massive overhauling. And for that, also you need finance. You need a healthcare budget. In a big way, you need modern hospitals with state-of-the-art infrastructure in India. Right now, we do have such hospitals, but they're not accessible to everyone. They're only for a limited elite population. So one has to be proactive, ramp up the infrastructure. On a long-term basis, we should be doing this. And this government is strong, but it has to deliver. And all the governments in future also have to work on this. This has to be our priority. Otherwise, we'll be facing these pandemics and these resurgence of viruses every other day. So now what we have learned is that we have to be proactive. As Dr. Mahajan said, safety protocols have to be followed, genomic sequencing has to be done. And I would again say that help the government. Government is doing a lot. We also have to do something regarding the vaccination, regarding the in whatever way we can. And we also have to bridge the gap between the public and the private sector. The private sector can also help. There should be locations like stadiums, cinema halls, wherever you can, shopping malls where you can have vaccination sites. And it has to be done in a big way. And to handle vaccine hesitancy, as I already spoke about that, it has to be done because vaccination is going to take us through. China has vaccinated more than 1 billion people. We are at 31. US is at 32. We're almost done equal to that of US, but look at our population. It's a humongous task. And apart from vaccination, again, as I said, see, we faced everything in the second wave. Shortage of beds, shortage of remdesivir, shortage of whatever, basic medicines, hoarding. All this has to be looked into. There should be no black marketing of medicines, especially essential medicines, life-saving medicines. And regulation has to be there. It's not if the third wave might come, but we have to be prepared for it. And the mistakes that we committed previously, we have to work on those. And that's what we have to learn. Basically, ramp up the infrastructure, do vaccination in a big way, and over a period of time, build your healthcare infrastructure. I think that's what is lacking in India right now. We have a tough time. 70% of the healthcare business is in the private sector. I mean, we cater to 70% of the population. I mean, the private, public, both have to. Even the government hospital should be well equipped. I mean, people should be able to go to a government hospital. There's a lot of hesitancy. People don't want to go there. So there's overwhelming of the private sector. And the entire system collapsed in the second wave. So we have to really ramp it up. I think that is the most important thing. Apart from the fact that people also have to understand their contribution, that they have to follow the norms, they have to do everything. I mean, even the people who are at the lower rung of the economy, these people also have to be vaccinated. I'm glad the vaccination is free for 18 and above from 21st
That's
onwards.
where the hesitancy is the most, actually.
Yeah, of course, but we have to explain it to them. take them into confidence. That's why the awareness campaigns are very important. So we have to take it to the next level. I mean, the government is working at it. They can buy the vaccines, they can do everything, but the last mile logistics depend a lot on the private sector. The private collaboration with government is needed badly. And I would also say that the poor healthcare services in our country and the infrastructure shortages have to be addressed at the earliest. Otherwise, there will be resurgence of viruses and pandemics will go on and we'll be suffering day in and day out. We're now potentially looking at a third wave because again, we're going through that cycle where people are not following the norms. Now this variant as well. Luckily now we're doing genomic sequences and we might be a little more proactive now in preventing a surge. We're doing well at the moment. We have 50,000 odd cases for the last 1 week or so, and 75% of those cases are limited to the four southern states and Maharashtra. But we are in the middle of a second wave even now. There are 75 districts in India which are more than 10% positivity rate even now. So we're talking about the third wave. We are still in the middle of a second wave. So let's get out of it first, and then we deal with the second wave. But I'm sure we'll be able to blunt it with aggressive vaccination, and if we get the support from the people.
Which is very interesting, Dr. Datta. Support from the people is really what's important. But, I just wanted to focus a bit more. You had touched upon it, the long COVID cases. Are we still seeing that? Your hospitals right now, if people who are suffering more from long COVID are there or people from COVID are there also?
Yeah, so the acute COVID cases have definitely ground to a halt now. So we don't have that anymore. But see, the post-COVID has so much sequelae, which we never encountered in the first time around. The first time around, we had patients, they got better 4 weeks, possibly 6 weeks, and then they were, they'd get back to normal. Long COVID was recognized even then, but more so this time around. So there are two sort of distinct groups. One is long COVID is referred to by the CDC for any COVID symptoms that go beyond 4 weeks. So these are symptoms that may have abated and returned, or symptoms that may have just continued, or symptoms that weren't there initially when they were COVID positive, but then have suddenly come up in the second sort of month of their illness, so to say. So COVID transformed from a 2 to 4 week illness to something which is possibly 3 months or even 6 months. So that is a continuation of the typical COVID symptoms of low-grade fever, which would keep coming back, body ache, immense fatigue, breathlessness, chest pain, headaches, things like that. So that is sort of what is referred to as long COVID. On the other hand, we are seeing the sequelae of COVID, of the bad lung damage that was done, by the acute infection, where people had just extensive lung changes, which then went on to develop into fibrosis. We've never seen lungs like that, so stiff, and nothing works for these people. And then the lungs almost, to dramatize it a little bit, they pop, so to say, and air leaks happen. And we get these things called pneumothoraces, which need tubes to drain them out. So right now we have, a few wards which are full of these patients who have pretty bad lungs, lung fibrosis, pneumothoraces. And then to add on to that, black fungus, not only involving the sinuses and the eyes, that was originally what we saw, but also fungal infection in the lungs. And that is sort of harder to treat because they're not so amenable to surgery because the lungs are already pretty bad and they're oxygen dependent. And, I don't know, these people may take, months. If they come out of it, it'll take months. So yes, we are still inundated with that. We're inundated with people with septicemia, with urinary tract infections, and then of course the mucormycosis involving what the ENT people are looking after, in the sinuses and the eyes. And certainly it has come down. It was like an epidemic within an epidemic, the mucor. And maybe 2 to 3 weeks ago, they were operating on 10 to 12 cases a day of mucormycosis or black fungus involving the sinuses. And now it's sort of 1 or 2 a day. So that's abating as well. But again, we ran into a tremendous shortage of amphotericin, the medicine for black fungus. And I think, again, our preparedness should certainly make sure that vital medications we should not run out of. Oxygen was a biggie, but even, medications we cannot afford to run out of. And there was a point at the peak of the second wave when I think we had run out of steroids even, which of course, ill-used and misused, did lead on to some extent black fungus. But again, bearing in mind that black fungus is a disease that as clinicians we used to see maybe 2 cases a year in patients who had, transplant. Like it speaks of profound immunosuppression or immune system being, suppressed. And this time we just see so many of them all at once. And so these are things that we've never encountered, but we have to learn from them, and we have to learn enough so that we're not taken by surprise in this manner in the third wave when it happens, and which we again hope to avert the course. We hope that it doesn't go anywhere near how it went in the second wave. But regardless, our preparedness is vital.
Final word to you, Dr. Mahajan. In this gap before, when we're not yet out of the second wave and we are staring at a third wave. So what is your message to our viewers?
The message remains the same, Priya, that you have to be responsible, act responsibly, and COVID appropriate behavior. What we've been saying all along, it's been over a year: mask, 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 hand hygiene, social distancing, and now social distancing of different kind, because we know now for sure that it travels through the air. And so that's very important. And most important, vaccine is available free. If you want it near your home, the private sector is also providing it. Please go get vaccinated, because vaccine, irrespective of the Delta variant, is, one of our Covishield is 92% effective in preventing serious illness or hospitalization. 92% is a huge number. Even one dose is good enough to prevent about 60% of serious disease and 30% of any kind of illness. So it is very important. Similarly with Covaxin, very effective, and I'm sure as data comes in for the Sputnik vaccine as well, so do get vaccinated, because it will save your life. So it's not a new lesson, it's all the same.
Ending with the old message, as Dr. Mahajan says, and the other doctors have also said on the panel, do get yourself vaccinated. This vaccination hesitancy is really what is keeping us, the waves coming, and keeping us, not being safe at all. So in the interest of everybody, I think do get that vaccination. But thank you all for joining us, and hope to see you soon in better times and happier times. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.